Cancer. What is it? Why does it happen? How can we prevent it? And what are the treatments? Hello everyone, and welcome to today's video. Today we're going to talk about one of the most important health topics in the world, cancer. Many people feel scared when they hear the word cancer. However, understanding what cancer is, why it happens, how it can be prevented, and how it is treated can help reduce fear and encourage people to seek medical help early. In this video, we will discuss what cancer is, why cancer develops, common signs and symptoms, different types of cancer, how doctors diagnose cancer, ways to reduce the risk of cancer, available treatment options, common myths and facts about cancer. So, let's begin. What is cancer? The human body is made up of trillions of cells. Normally, cells grow, divide, and die in a controlled and organized way. This process helps the body stay healthy. Sometimes, changes occur in a cell's DNA. DNA contains the instructions that tell cells how to behave. When DNA becomes damaged, cells may begin growing uncontrollably. Instead of dying when they should, these abnormal cells continue multiplying. Over time, these abnormal cells can form a mass called a tumor. When these abnormal cells invade nearby tissues or spread to other parts of the body, the condition is known as cancer. Not all tumors are cancerous. Some are benign, meaning they do not spread. Cancerous tumors are called malignant tumors because they can spread and damage healthy tissues. Why does cancer happen? Cancer does not usually develop because of a single cause. It is often the result of a combination of factors. 1. Tobacco use. Smoking is one of the leading causes of cancer worldwide. Cigarettes contain thousands of chemicals, many of which can damage DNA. Tobacco use increases the risk of cancers affecting the lungs, mouth, throat, esophagus, bladder, kidneys. Even secondhand smoke can increase cancer risk. 2. Unhealthy diet. A poor diet can contribute to cancer development. Eating large amounts of processed foods, sugary drinks, and processed meats while consuming too few fruits and vegetables may increase risk. 3. Obesity. Being overweight or obese is linked to several types of cancer. Excess body fat can affect hormone levels and promote chronic inflammation, both of which may increase cancer risk. 4. Physical inactivity. A lack of exercise may contribute to obesity and other conditions associated with cancer. Regular physical activity helps maintain overall health and lowers risk. 5. Excessive sun exposure. Ultraviolet radiation from the sun can damage skin cells. Repeated damage over time increases the risk of skin cancer. 6. Infections. Certain viruses and infections are associated with cancer. Examples include human papilloma virus infection, hepatitis B, hepatitis C. 7. Genetic factors. Some people inherit genetic mutations that increase their risk of developing certain cancers. However, most cancers are not directly inherited. 8. Environmental exposure. Long-term exposure to harmful substances such as asbestos, radiation, or certain industrial chemicals can increase cancer risk. Common signs and symptoms of cancer. Symptoms vary depending on the type and location of cancer. Common warning signs may include unexplained weight loss, persistent fatigue, a lump or swelling, ongoing pain, persistent cough, difficulty swallowing, changes in bowel or bladder habits, unusual bleeding, skin changes, a wound that does not heal. Having these symptoms does not necessarily mean someone has cancer, but persistent symptoms should always be checked by a healthcare professional. Types of cancer. There are more than 100 different types of cancer. Some of the most common include breast cancer, lung cancer, prostate cancer, colorectal cancer, skin cancer, leukemia. Each type behaves differently and may require different treatments. How is cancer diagnosed? Doctors use several methods to diagnose cancer. Physical examination. The doctor checks for lumps, swelling, or other unusual signs. Blood tests. Some cancers can affect blood test results. Imaging tests. These include X-rays, ultrasounds, CT scans, MRI scans, PET scans, biopsy. A biopsy is often the most important diagnostic test. During a biopsy, a small sample of tissue is removed and examined under a microscope to determine whether cancer cells are present. How can cancer be prevented? Although not all cancers can be prevented, many cases can be avoided by reducing risk factors. Avoid tobacco. This is one of the most effective ways to reduce cancer risk. Eat a healthy diet. Choose fruits, vegetables, whole grains, beans, and legumes. Limit processed foods, sugary drinks, processed meats. Exercise regularly. Aim for at least 150 minutes of moderate physical activity each week. Maintain a healthy weight. Keeping a healthy weight lowers the risk of several cancers. Protect your skin. Use sunscreen and avoid excessive sun exposure. Get vaccinated. Vaccines can help prevent some infections associated with cancer, including human papillomavirus infection, hepatitis B. Regular health screenings. Early detection can save lives. Regular screenings help identify some cancers before symptoms appear. Cancer treatments, 3 minutes. Treatment depends on the type, location, and stage of cancer. 1. Surgery. Doctors remove the tumor and surrounding affected tissue. 2. Chemotherapy. Chemotherapy uses powerful drugs to destroy cancer cells or stop them from growing. Radiation therapy. High-energy radiation is used to target and kill cancer cells. 4. Immunotherapy. This treatment helps the body's immune system recognize and attack cancer cells. 5. Targeted therapy. Targeted drugs focus on specific molecules or genetic changes involved in cancer growth. 6. Hormone therapy. Some cancers depend on hormones for growth. Hormone therapy blocks or reduces those hormones. Often, doctors combine multiple treatments to achieve the best results. Can cancer be cured? Many cancers can be successfully treated, especially when detected early. Advances in medical science have dramatically improved survival rates. Millions of cancer survivors around the world continue to live healthy and productive lives after treatment. This is why early diagnosis and timely treatment are so important. Common myths about cancer. 1 to 2 minutes. Myth 1. Cancer is always fatal. Fact. Many cancers are treatable and sometimes completely curable when detected early. Myth 2. Cancer is contagious. Fact. Cancer does not spread from person to person through touch or casual contact. Myth 3. Only older people get cancer. Fact. While cancer is more common in older adults, children and young adults can also develop cancer. Myth 4. Every lump is cancer. Fact: many lumps are harmless, but any unusual lump should be examined by a doctor. Conclusion: 1 minute. Cancer is a serious disease, but knowledge is one of our strongest tools against it. By making healthy lifestyle choices, avoiding tobacco, staying physically active, eating nutritious foods, protecting ourselves from harmful exposures, and attending regular health screenings, we can significantly reduce our risk. Most importantly, never ignore unusual symptoms. Early detection can make a huge difference. Thank you for watching. If you found this video helpful, please like, share, and subscribe so more people can learn about cancer awareness and prevention. Stay healthy, stay informed, and see you in the next video.